Welcome back. Dr. Patel, a board-certified ophthalmologist, is here from Florida Eye Specialists. He's an expert on cataract surgery, so thank you for coming in.
Well, thank you for having me.
A lot of people have cataracts, and actually, he told me before we went on the air, everybody gets cataracts, correct? It's an age thing.
Correct, yeah. Cataracts is the lens in the eye. As we get older, the lens becomes cloudier, and that's what's known as a cataract. So I always tell patients, you just have to live long enough in order to get cataract surgery, because we all get them.
And I was asking him, is there anything that maybe would cause somebody to get cataracts faster than someone else? Since we're all going to get them eventually, like you said, if we live long enough, does it have anything to do with sun exposure? And the other myth I had heard is the color of your eyes. Can you talk about that?
Right, so there are some literature studies that say, okay, maybe excess UV radiation or excess exposure to sunlight can accelerate cataract formation. But we know that cataracts occur in everybody, and we have seen that patients that have excess UV or being out in the sunlight a lot don't necessarily have acceleration in their cataracts.
Okay.
So it's not really true, but it's still advisable to wear sunglasses to protect your eyes, obviously.
And polarized, I guess, lenses and so forth, does
are
that
definitely
matter?
helpful, especially in sun-prone environments like ourselves here in Jacksonville. You know, the other thing is a lot of people have the kind of misunderstanding is the color of the eye makes a difference. It doesn't. The color of the eye is just directly proportional to how much pigment is in your iris, or the colored part of your eye.
Right, and I know people with lighter pigmentation on their skin, though, however, are more prone to sunburns than people that sometimes have a darker complexion. So that may be where the myth starts. If the lighter eyes may get cataracts before the darker eyes, and you say that's not the case.
Correct, not the case.
Okay, and he brought along some video, some animations of some of the different types of surgery that they do now for cataracts, and it's something that is evolving all the time, and you guys are learning, I guess, new information, new research is changing the way things go. Now, what is this? This is the older surgery?
So, you know, cataract surgery is one of the most common and successful outpatient procedures performed in America.
That's good to know, yeah.
Over half of Americans over the age of 80 have had cataract surgery successfully done. Cataract surgery, it takes approximately 15 to 20 minutes. Recovery is very quick. And the traditional way of doing cataract surgery, as you're watching now, is we make a small incision in the cornea, or the clear window of the eye, break up the cataract or the cloudy lens using ultrasound energy, and then put in a lens implant made of plastic-like material that you're seeing there. Now, however, advanced technology has allowed us to do laser-assisted cataract surgery.
Okay, how does that work?
The laser automates the most challenging steps of the cataract surgery. It makes the incision in the eye, it makes the opening in the cataract, and it even fragments or breaks up the cataract itself, so it's easier to take out of the eye and creates less energy in the eye. It's obviously a much more safe and precise and accurate way of doing cataract surgery compared to traditional cataract surgery where we use a blade.
Okay, and the cornea is the clear covering of the eye, and that's not what we're talking about. The lens, apparently, the part that has this growth that gets cloudy, is behind the pupil and the iris. So one of the things you guys do then is to dilate the pupil to make the hole larger for you guys to get in and get access to the lens, I guess, correct?
Exactly. You're exactly correct. So the cornea is the first structure you were to touch if you were to touch your eye. The iris is the colored structure of the eye, and the lens rests behind the iris.
Okay.
So in order to successfully do cataract surgery, we dilate the eye so we can have better access to the lens. That's exactly correct.
Right.
And you know, you were talking earlier when we had met about LASIK versus this laser, and there's all different types of lasers in medicine, and this is just one of the types of lasers that we can use. LASIK, on the other hand, uses a laser to reshape the cornea and change the prescription in the eye.
Okay.
However, patients that undergo LASIK will still ultimately develop a cataract because that's an age-related change.
Okay, so the LASIK technology then, for somebody that may be in their 20s that hasn't developed a cataract at this point, then they would just have their cornea reshaped, and maybe that would change the prescription on their glasses so they could go without. So let's say, is it possible that someone could get cataract surgery because you're going to use a laser and basically you can do the same thing? Could we have that done early?
Correct. That's the beauty about modern day cataract surgery. Now, it's not only an opportunity to improve your vision, but make you spectacle independent.
Okay.
So now there's so many more options.
Meaning
in
no
cataract.
glasses,
Correct.
no spectacles.
Correct.
Okay.
There's so many more options in cataract surgery where we can take patients that have astigmatism or irregular curvature of their eye and correct it either with the laser or lens implants that correct astigmatism. There's even lenses like these no-line bifocals that allow patients not only to see well far away, but also up close, so you wouldn't have to wear any glasses. And the great part about cataract surgery is that it's permanent. So once cataract surgery is done, you don't have cataract surgery again.
Right, because you've actually replaced whatever you've taken out, the lens, with a piece of, this is a new kind of piece of plastic, right? That actually, and there's constant technologies in this as well, right?
Absolutely. There's hundreds and hundreds of different manufacturers of lens implants, and the lens implants vary in materials from acrylic all the way to silicone, and there's lens implants that flex in the eye or use your own eye muscles to help you see distance and up close.
What do you suggest is better?
There's not really what's better. I think you have to meet with your ophthalmologist or eye surgeon and have a discussion on the things that you would like to do before and after cataract surgery and some of your expectations. And I think that's the key in understanding what lens implant is best for you.
That's some really interesting information. Dr. Patel, thank you so much for coming in.
No problem, no problem.